This is LiveWell Talk on St. Luke's Marion ER. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health St. Luke's Hospital. St. Luke's has opened an emergency room in Marion, Iowa, located at 3301 Armar Drive, next to the old Barlow's for the Cedar Rapidians listening to the broadcast. It's an off-campus ER, meaning it's not attached to the hospital. Joining me today on the podcast is Dr. Sarah Hooper, St. Luke's Marion ER Medical Director. Dr. Hooper, welcome.
Thank you. I'm so happy to be here and excited to talk about this new ER.
If it's Hooper, where's the other O?
Now that is a very good question.
That's the first question that listeners are probably wondering.
Well, there used to be an umlaut over the O, but this legend is that when my great-great-grandfather stowed away on a boat across to the St. Lawrence and down into the Hudson Bay and hit the United States border, there were two families that showed up, and it was encouraged that they change their spelling. So one became Hoeper, and the other was Hopper.
So that's where the other O went.
Yeah. It got lost in the St. Lawrence, I guess.
I'm glad. I always have had trouble with your last name, always making that mistake. So I'm glad now I know where it's at. We've put that to rest. So now that we've addressed that with the listeners, let's talk about the Marion ER. Freestanding ER, something new to the hospital. And prior to the podcast, we were talking. This is new to you as well. And you're going to be leading our team out there. Tell us about it. Tell us what it encompasses and how's it going to function.
So it's going to function very similar to the ER downtown in Cedar Rapids here. We'll still be able to see the same types of patients who are going to be a little bit more ill than patients who would typically go to an urgent care. We have the capabilities of taking care of very sick patients or patients with sepsis or patients with chest pain and abdominal pain. If a patient should require admission after we have initialized their treatment in the ER and have diagnosed them, for example, with appendicitis, then they will be transferred to the St. Luke's Hospital where they can go to the OR or be a direct admission to the patient floor.
And is the whole concept here to make access easier by kind of, if you will, decompressing the hospital ER downtown, if you will?
Yeah, absolutely. Our hope is...
And Marion's growing. I mean, that's huge.
For sure. Marion has had a tremendous amount of growth, and it'll be nice for patients to be able to get emergency care closer to their homes. It is also hopeful that it will decompress our ER downtown in Cedar Rapids a little bit and help to decrease wait times here as well.
So if the patient needs to be admitted to the hospital, we will transport them to the hospital to be admitted, correct?
That is correct. Patients would go typically by an ambulance from the Marion ER down to St. Luke's. The hope is that the patient would not spend additional time in the St. Luke's emergency department downtown, but rather to go directly to the care that they need
to go. Mm-hmm. And as far as hours of activity, 24/7, just like any other emergency room?
You got it. Us emergency doctors really pride ourselves in providing care 24 hours a day, 7 days a week, 365 days out of the year. So whether it's Christmas Eve or happens to be Hanukkah, we're happy to serve you, and we'll be here available in the Marion ER.
Wow. How big is it?
We have 12 beds that we can see patients in. We have a CT scanner, an x-ray machine. We have a lab that's in-house there as well. We have a pharmacy area where our nurses will be able to store pharmaceutical medications and mix up drips that may be needed for more ill patients. And so it's quite a large space.
Right. And I actually envision that some of you won't be competing as far as resources with the physical hospital. So, I mean, you're probably actually going to get x-rays faster. Lab work might come back a little faster because, you're not dealing with the other 435 patients that might be in a bed at that time, correct?
Yeah, I think that is definitely a possibility. Our group does service several critical access hospitals that have a much smaller inpatient bed number, and typically at those hospitals we find that we are able to get our labs back a little bit faster, just because there's not the competition of all of the patients that are currently admitted to the hospital.
Yeah, it kind of captured audience, so to speak. So 13 rooms. How does that compare to what we have at St. Luke's?
Yeah, at St. Luke's we have 34 beds that we can see patients.
So it's about a third of the size. How did you miss a meeting? Then he said, "Oh, Sarah's not here. Let's make her the medical director." That's how most of my career is. I've gotten where I've gotten is I miss meetings. And then so I got volunteered for stuff and then found out later. Did that same happen to you, or were you interested in this?
No, I was definitely interested in it. I was looking for career growth and administration opportunities. And so this came up and I was excited to take it.
Well, and all joking aside, you have a stellar reputation as a physician as well as a leader. And you also have a legal degree, correct?
That is true. I did go to law school, but have never practiced law.
Never practiced law. Did you go to law school, then go to medical school?
I did a joint degree, so they were sort of mixed in together. So I did 2 years of medical school, and then law school started in the summer. So I did a summer and a year of law school. I went back and did another year of medical school, and then finished up with law school, and then did my 4th year of med school. So it was all kind of broken up, but not at the same time. People often ask me, how did you take both classes at the same time? I didn't. It took me 6 years.
I watched a lot of Law and Order when I was in medical school. So
well, it's probably about the same.
Yeah, we could probably sit down and talk about that sometime. How we talked before the podcast about patients self-selecting. What advice would you give a patient that is feeling ill and they have the choice of an urgent care or the freestanding ER? How would you advise them? And let's throw the Unity Point Express cares in there as well. What advice would you give them when to go and where?
Well, an express care is a great place to go if you've got something that you think can be treated quickly, where you might need an antibiotic for a pneumonia that is not going to require an admission to the hospital because you're still able to walk around your home freely. You've got a cough, but you're not so short of breath that you have to sit down and rest. That would probably be a great place to go to an express care. An urgent care is going to have a little bit more services available to you. If you think that you probably have an ankle sprain and not an ankle fracture, but you want to get it checked out, that's a great place to go to get an x-ray. Can get some splint and some crutches and be on your way quickly. And then the emergency department or the freestanding ER that we're talking about in Marion would be a great place to go if you're more concerned that maybe I actually have a broken bone. We're going to be able to set bones there. We will be able to get more advanced imaging, and that we have a CT scanner available to us at that emergency department, which would not be available at most urgent cares. We are going to be able to start care on any type of patient that comes through the door, even if they're quite sick. However, if you are thinking, gosh, I'm pretty sure I'm going to have to be admitted to the hospital because I'm so sick, then you may want to go downtown to St. Luke's in the main ER because it may be faster to get you into an inpatient bed.
Well, and over time, I'm sure Cedar Rapidians and Marionites will kind of factor that in, but you'll get people that just see the emergency and might show up in labor, etc. So have you ever delivered a baby in the emergency room?
Yes, that does happen. Not too infrequently. I would guess that most of our ER docs have probably delivered between 5 and 10 babies throughout their careers in the ER for patients that have showed up in emergent labor.
Wow.
But we certainly hope that most of those patients make it to their to the main hospital and their OB-GYN.
Absolutely. Well, this will be staffed with physicians and nurse practitioners and PAs, just like our other emergency room?
Actually, we'll only have physicians to start out with. So our volumes are such that we anticipate that we'll only need to have one provider there to start out. And when we ramp up with our patient numbers, we'll certainly be looking at adding a second provider. But to start out with, there will be a board-certified emergency medicine physician who is caring for you at the Marion ER.
Outstanding. Now, if I call 911 and an ambulance arrives, is there a possibility, depending on what I have, that it would go to the Marion ER, or would that just always go to downtown?
No, certainly a possibility that an ambulance could bring you to the emergency department. For example, if an ambulance were to pick you up and could see pretty clearly that you had a broken hip, it is likely that they would bring you downtown because you're going to need to have surgery on that and to have an orthopedic consult. However, if you have a deformity of your arm that would likely be x-rayed and then reduced in the emergency department and splinted and sent home to see the orthopedist at a later date, it is very likely that the emergency crew may decide that you should come or suggest that you should come to the Marion ER to get seen perhaps a little bit faster.
And accessibility and parking, I think we have pretty decent parking at the hospital for patients on the west side of the building, but how's it at the Marion ER?
Yeah. as you may recall from your days of shopping at Barlow's, there's a pretty big parking lot over there. It's in the area where the U.S. Cellular used to have a call center in this same strip mall. And it also used to be where Jewel's Bakery is. So it's quite a wide open parking lot, and I don't think people have any difficulty with that. There's certainly an area where you can drive up and drop your loved one off so that they don't have to walk. And we'll have patient access personnel available up at the front desk who can help to get patients inside the building or call nursing staff to help get patients in as well.
That's outstanding. What is, of all the things and that have been going through your mind with this, what are you the most, not anxious, but excited to see? What, like, you really want to see what happened?
Yeah, well, we just don't really know how quickly it's going to ramp up with the patient population. And so we're very excited to see when we open up on the first day, are we going to see 12 patients or are we going to see 24 patients? At the St. Luke's Emergency Department, we typically see about 150 patients a day. And so we just are not sure where we're going to fall on that spectrum. We certainly anticipate it's going to be less than 150 patients. But we want to know quickly, how fast is this going to grow? How fast is the community going to accept this ER is available to them and start to utilize us?
So kind of a housekeeping question we always ask the guests, why emergency medicine?
Well, that is really easy. I grew up in the late 90s and early 2000s in the era of ER, the television show. And Noah Wiley was an actor who started out as a medical student on that show. And I started watching it when I was in high school and watched it through college. It was the one night, Thursday night, that we allowed ourselves to take a break from studying and to go watch TV. And it was awesome. And I thought, why the heck wouldn't I want to do that?
Must-see TV,
yeah, absolutely.
Yeah, you had Seinfeld, Friends, and then 9 p.m. was ER.
Yeah.
I was actually in medical school when that was on, and that was especially the first like 5 seasons were just really good. I mean, they were kind of cliffhangers, and like most shows, they jump a shark eventually, and it gets a little silly. But that's interesting.
It's true. There's actually been 20 seasons of it, and when my daughter was much younger, probably much younger than she should have been watching with me, we ended up watching all 20 seasons together over a very long period of time. But it was very interesting to watch how the medical procedures changed and the topics changed. When the show first started, HIV and AIDS was a huge topic.
Yeah.
And by the end of the show, 20 years later, that was no longer such a big topic anymore.
Yeah, that is, I often wonder, will my grandchildren go into medicine and go, can you believe my grandpa used to give people aspirin? You know, who knows? I mean, or just all sorts of stuff, you know. But Dr. Hooper, thank you for joining me and inform our listeners about the St. Luke's new Marion ER. This has been great information. Once again, this is Dr. Sarah Hooper, St. Luke's Marion ER Medical Director. To learn more, visit unionpoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.